Basic surgical instruments. Different surgical procedures warrant the use of different surgical instruments. Knowing each instrument and its functions, as well as the basics in handling them, is the key to an easy flowing surgery. Scalpel blades. Blade holder. Blade number 11, also known as the stab knife, with its elongated triangular blade sharpened along the hypotenuse edge is with a strong pointed tip. Blade number 12, small, pointed, crescent-shaped blade sharpened along the inside edge of the curve, utilized as a suture cutter but also for arteriotomies, parotid surgeries, and uterolipotomies. Blade number 15, small curved cutting edge, and is most popular blade, ideal for making short and precise incisions. Blade number 10, used generally for making small incisions in skin and muscles. Blade number 20, a large version of blade number 10 with a curved cutting edge and an unsharpened back edge, used for orthopedic and general surgical procedures. In placing the blade into the blade holder, one should never use his bare hands to avoid unwanted injury. Instead, use the needle holder to pick up the blade and place it into the blade holder. In removing the blade from the holder, one should similarly use the needle holder. Needle holder must be held in a tripod or palming technique, and the needle must be placed 2/3 from the cutting point. Handling of surgical instruments. General guidelines. Ring instruments must utilize the ring and thumb as stabilizers of the instrument handle. Instruments must be held in prone position. The size of instruments must be proportionate to the tissue being handled. Needle, shaft, body, tip. Round needle, used for penetrating friable parenchymal and vascular tissues like the liver, spleen, and kidneys. Cutting needle, closure of superficial wounds and incision. Suture, absorbable sutures, breaks down over time in body, examples of which are catgut, polyglucaprone 25, chromic O, for closing of the fascia layer in the abdominal surgery.